Is there a age or a gender or a sort of, list of symptoms, if you will, that says to you, "Oh, this might be Lewy body. Let me go talk to a doctor."
That's a great question. So the symptoms are very different, as we talked about. And so there's some checklists out there. We have a couple on our website. One is called our comprehensive symptom checklist. It's for families. And so you're going through and kind of ticking the boxes that match up so you can have that informed conversation with your medical provider. We also have one for clinicians that has the diagnostic criteria on the back end. So it helps them kind of walk through the steps of diagnosing someone. There's also a great screening tool out there developed by Dr. Jim Galvin at the University of Miami called the Lewy Body Composite Risk Score. And I believe it's like 10 items or so that you can kind of check as a screening measure to see if someone's leaning more that way. But then also a neuropsychological evaluation often can be very helpful because when a seasoned neuropsychologist gets in there and does, rather than just doing that global measure, because we have a great slide by one of our researchers in Mayo where they compared how people did in different cognitive tests. With Alzheimer's and with Lewy. And what's fascinating is if you're doing just like a general screening, like a dementia rating scale or a MOCA, a lot of times they don't look different. It's when that neuropsychologist gets into those different elements that a lot of times it will tease out. And then also some of the more psychiatric type features, hallucinations, delusions. There are also sleep symptoms. So often people have REM sleep behavior disorder many, many years prior to symptoms where they'll violently act out their dreams. So there's things they can look at other than just the cognitive profile to help make that diagnosis through those checklists and through those exams.